Hello, and welcome to my presentation about histoplasmosis. My name is Lindsey Leake, Master's of Public Health, graduate student at Purdue University. Thank you so much for joining me. Let's get started. Histoplasmosis is an invasive fungal disease that is caused by a parasitic fungi called histoplasma. It often causes pneumonia and may disseminate into other organ systems. It's also referred to as histo. This type of parasitic fungi is very commonly found in bird and bat feces. Histoplasma capsulatum is endemic to the United States and is commonly found in the Mississippi and Ohio river valleys. Another variant of this species of fungi called Histoplasma capsulatum debosii is a variety that is commonly found in Africa due to the exposure of bat guano, also known as feces. The image on this slide here you may be familiar with, maybe not, depending on your age. This shows the fictitious character Ace Ventura Pet Detective, played by actor Jim Carrey, licking a perceived fruit paste from a bowl and fingers. Soon after consuming this fruit paste, Ace is informed that bat guano is bat feces. So it's quite possible that Ace would have acquired histo from that direct contact in consuming bat guano feces. Transmission of histoplasmosis is typically contracted after the inhalation of spores of the fungus Histoplasma capsulatum. This fungus thrives in soil with high organic content that is laden with bird droppings, especially around poultry houses, caves that harbor bats, starlings, blackbirds, and pigeons. However, I did want to point out that direct contact through droplet spread, or as we saw on the previous slide, if someone were to consume bat feces or bird feces in some way, some cases of histo may present in patients that have had the direct contact with bird droppings, and while it is primarily indirect contact through airborne transmission, direct contact with droplets should not be discounted. Histoplasma capsulatum spores become airborne, and they are easily carried by the wind current over long distances. Here you see the life cycle of histoplasmosis once it enters the body. So as I mentioned, the fungi Histoplasma capsulatum, after the spores have been circulating in the air, maybe the wind current has carried them for a short or long distance, but after they have been circulating in the air, after contaminated soil has been disturbed, a person breathing in those spores are at risk of developing histoplasmosis. Now, the spores are in fact too small to see without a microscope, so there really is no way for a person to avoid breathing in these spores. So once the spores have entered the lungs, the person's body temperature allows for the spores to transform into a yeast. That yeast can then travel to lymph nodes and spread to other parts of the body throughout the bloodstream. The CDC utilizes data from the National Vital Statistics System multiple cause of death database to determine the number of deaths from fungal infections in the United States. Histoplasmosis is not a nationally notifiable condition in each state, so the information that we do have about incidence and prevalence is not as up to date, specifically since at the time there were only 12 states that were reporting histoplasmosis, and now there are a total of 13. But I will mention more about it not being a nationally notifiable condition in a few moments. So the incidence, an estimated 6.1 cases per 100,000 population in the Midwestern part of the United States. Now, Midwestern part of the United States. So as I mentioned, this fungi, Histoplasma capsulatum, is most commonly found in the Ohio and Mississippi river valleys in the United States. So it does make sense that an estimated 60 to 90% of people who live in these areas have been exposed to this fungus at some point in their life. And also, as you can see, the total number of deaths in 2021 were 199 from histoplasmosis. Of those, 21 were associated with COVID-19, which I will talk briefly about. And hospitalizations, 4,630, which that resulted in 222 million for direct medical cost and 110 million for indirect cost. So I'd like for you to keep in mind the amount of money, the millions of dollars that are spent in direct and indirect medical care costs, over 4,000 hospitalizations and almost 200 deaths from histoplasmosis diagnoses, as I speak to you about the signs and symptoms of histoplasmosis. So the interesting thing about this invasive fungal infection is that the vast majority of infected people are asymptomatic, which means they do not have symptoms, or if they do experience symptoms, they can be so mild that they mimic cold or flu-like symptoms, and most of the time people do not seek medical care for those. As I mentioned, the signs can vary in severity from mild to a severe or fatal form of the disease known as disseminated histoplasmosis. So in acute pulmonary histoplasmosis, a chest x-ray will commonly show patchy pneumonia, which will eventually calcify. Chronic lung disease due to histoplasmosis can resemble tuberculosis and can worsen over months and years. So as this disease progresses from primary acute to disseminated, some of the symptoms and signs of the disseminated form of the disease would include weight loss, anemia, night sweats, pain all over the body, pneumonia, enlargement of the spleen and liver, and gastrointestinal ulcers or issues. The most severe and rare form of the disease involves, the fungus spreading to other organs outside of the lungs. So disseminated histoplasmosis is fatal if untreated, but death can also occur in some of the patients even when medical treatment is received. So it's very important, which I will mention later on, but it's very important for histoplasmosis to be detected early. This brings me to the incubation period and treatment for histoplasmosis. So symptoms can begin to develop between 3 and 17 days after exposure, with an average of 10 days. However, that's not always the case. Sometimes people have been exposed and then symptoms don't really begin until much later, 30 days after exposure. It really just is sometimes a case-by-case basis, but that is the average, between 3 and 17 days after exposure. Histoplasmosis is a treatable condition, fortunately. It does require the use of antifungal medication. Itraconazole is the most common antifungal treatment that is used for patients, but sometimes patients may also require treatment with steroids such as prednisone, depending on the severity of their infection. Patients can be on this antifungal medication for up to 1 year, depending on, again, the severity of their infection. So in a person that has been battling histoplasmosis for quite some time and they've had long-term complications due to that, sometimes these patients will develop what is known as presumed ocular histoplasmosis syndrome, which can cause vision loss. So as you can see in the slide, what happens is that small white spots appear deep inside the eye, and then that can cause new blood vessels to form inside of the eye. This condition can only be diagnosed by an ophthalmologist, and it does not occur very often, but it does happen in patients that have confirmed histoplasmosis diagnoses. The description of the population at risk. Histoplasmosis is a bit different in terms of the population at risk because anyone can contract histo. People with compromised or weakened immune systems, such as people living with HIV or AIDS, have had an organ transplant, taking any kind of immunosuppressive medication such as steroids or tumor necrosis factor inhibitors, adults that are 55 years or older, and infants. So all of those folks are considered more at risk of being susceptible to developing a severe form of histoplasmosis. So as I mentioned, anyone can contract histo. So who is the most at risk? So anyone living in the Mississippi and Ohio River valleys in the United States. So we attend Purdue University. If you live in Indiana like myself, guess what? We are at risk of contracting histo, especially if you engage in any of the activities you see on the slide there: cave exploration, outside in the garden planting flowers in the spring, a construction worker, having any direct contact or raising any type of birds or poultry, living near caves, living near poultry farms, any type of excavation. Those are the higher risk activities. So those people that engage in those activities and live in the Ohio and Mississippi River valleys are the most at risk of developing histoplasmosis. So histoplasmosis, the symptoms of this fungal infection can mimic COVID-19 with fever, cough, and shortness of breath. And a COVID-19 diagnosis actually increases the risk of patients contracting a fungal infection due to its effect on the immune system as well. It is not seen as much with histoplasmosis as it is in other fungal infections such as aspergillus, but it does happen. As I mentioned again, histoplasmosis is not considered a nationally reportable condition in all of the states. So the data from the map you see is from a MMWR report that was published by the CDC in August of 2022. So as you can see, 13 states, Arkansas, Delaware, Illinois, Indiana, Kansas, Kentucky, Louisiana, Michigan, Minnesota, Nebraska, Pennsylvania, Rhode Island, and Wisconsin all have histoplasmosis as a reportable condition. So very interesting to see. As I mentioned, the MMWR report that was published by the CDC in August of 2022 shows that the data that they looked at, there were 859 histo cases that were submitted. Among those with available information, most cases occurred in non-Hispanic white persons. The incidence rates for histoplasmosis were higher in non-Hispanic white persons, 1.3 per 1,000 population. So looking at the age groups with the highest incidence were 41 to 61 years old and 65 to 80 years. Now, it's also interesting to see that more cases occur in males than females. Now, that could be due to some of those higher risk occupations, such as construction workers, bridge repair workers, so on and so forth, because typically we don't see a lot of the female population having some of those jobs. Okay, so family history, genetics, mental health, and marital status do not appear to play a role in the demographics of patients that contract histo. However, more research should be conducted on those demographics of people living in the 13 states that we had talked about where the condition is reportable to further understand histoplasmosis and its occurrence. I wanted to provide more insight from the previous slide. So as you can see, any age, sex, race, or ethnicity may contract histo, although it is more prevalent in those groups that I mentioned in the previous slide. So it is really interesting to see that truly anyone may contract histo, and it does not matter what your age, race, or sex is, you are at risk if you live in any of these 13 states. The frequency of histoplasmosis is really consistent throughout most of the seasons, so spring, summer, and winter, and slightly higher in the autumn, which means depending on where a person may live within the Ohio and Mississippi River valleys, as I mentioned, could put them at an increased risk of contracting histoplasmosis. And what I mean by that is that their frequency and ability to get outdoors and engage in outdoor activities, that really puts them at a risk. So digging into the social determinants, that increase exposure and risk. So the neighborhood and built environment, the safety of folks in those areas being able to get outside, the location of housing, any type of new construction where the soil is being disturbed, living near farms that engage in invasive farming practices. Those are some of the built environment and neighborhoods that are an increase in risk. Healthcare access and quality. So histo can go unrecognized and untreated for quite some time, which I mentioned can lead to the disseminated form of this disease. So keeping in mind the healthcare cost and availability of treatment after diagnosis truly can also be broken down into health equity as well. So as I'd mentioned before, it's very important for early detection for histoplasmosis to be treated before it becomes disseminated. Environmental determinants that increase exposure and risk, climate change, specifically with climate change. In the U.S., it's caused so much change in the environment where this disease-causing fungi might live, and environmental fungal diseases such as histoplasmosis are becoming more common. So not the same one that you saw from The Last of Us in the HBO series if you watched that. Histoplasmosis is a little different, but climate change is increasing the frequency, intensity, and duration of extreme weather events such as droughts and wildfires, and these events can encourage the production and spread of fungal spores that cause this disease. Natural disasters, such as floods, can also cause the fungi to grow at a rapid rate. Changes in environment caused by urban growth and, as I mentioned, intensive farming practices can also affect this fungi and their spread. And then again, just wanted to mention the outdoor activities. Being outdoors in the areas where histoplasmosis is prevalent is a risk factor. Disparities. The MMWR report revealed that contracting environmental diseases can be influenced by health disparities and is more likely to afflict vulnerable and minority populations. So the data in this report was really important because it confirmed that health disparities in the occurrence of these fungal infections exist. And being able to understand the associations of this disease, the incidence, and social vulnerabilities may further explain the difference in reported incidences. Disparities also might be related to occupations, housing, and healthcare access discrimination. Disparities in health insurance status or access to healthcare might also impede a timely diagnosis and appropriate treatment. So American Indian and Alaskan Native and Asian Americans are more commonly affected by fungal diseases than non-Hispanic white persons. So in this report, there is nothing specific about the health disparities regarding histoplasmosis and its incidence. However, it is important to know that the vulnerable and minority populations are affected much higher by the fungal infections. Additional epidemiologic variables, screening test, and vaccine. So as you can see, there are quite a few screening tests that are conducted to be able to determine if a patient has histoplasmosis. Now, the gold standard or preferred test is a culture that would need to be a fungal culture to be able to determine whether or not a person has histoplasmosis. And it's good to know the serology of the fungus that is growing because it could be blastomyces, aspergillus, or another type of fungal infection. Antigen testing is conducted a lot as well, and it is most sensitive in severely ill patients. A small proportion of people, less than 5%, living in histoplasmosis endemic areas have a positive serology by CF or ID. Testing a single serum specimen can aid in diagnosis, but testing several serial specimens offers greater specificity. An antibody response may be absent in immunocompromised people. So it really makes a difference if the clinician is able to get a culture, do a fungal culture on a patient that's presenting with symptoms similar to histo to be able to determine if it is histoplasmosis. And then for vaccines, this is not a vaccine preventable condition, so there is not currently a vaccine available for histoplasmosis or any other type of fungal disease. So the hierarchy of controls that you see before you, this framework is from the National Institute of Occupational Safety and Health and utilizes methods at the top of the graphic as more effective and protective than those at the bottom. So we see elimination, substitution, engineering controls, administrative controls, and PPE. So with elimination, being able to exclude bats or birds from a building and being able to physically remove any type of bird feces or bat feces, engineering controls, that would be controlling dust generation, disposing of waste, administrative controls, developing site safety plans, posting health risk warnings, and hazard communication and training. And then PPE, workers wearing respirators, eye protection gloves, boots, shoe coverings, protective clothing. So histoplasmosis should be considered when workers in industries or occupations at increased risk have symptoms compatible with the disease. So implementing this hierarchy of controls in high-risk workplaces would be able to determine how to implement and how feasible it would be to utilize effective control solutions in occupational hazards. So gaps in the knowledge on histoplasmosis, there are quite a few. Due to histoplasmosis not being a nationally notifiable disease, there isn't, the reporting is limited and does not allow for us to have a complete picture of the data. Disseminated histoplasmosis may present with rare or odd symptoms, so I believe that more case studies and research need to be conducted for us to really understand how this disease presents and how we may be able to detect it early. A lack of surveillance data that exists, and the efforts to improve that should be inclusive of collecting data to understand the nationwide disease presence and treatment patterns, the emerging populations at risk, and exposure sources. High mortality and hospitalization rates for histoplasmosis really suggest underreporting of mild and severe disease while highlighting their severe clinical outcomes. So again, underreporting of the disease, early detection is very important, and that is a gap that we really need to improve on with this fungal disease. One of the recommendations to address histoplasmosis, providing supplying workers with that PPE that I mentioned in the previous slide would be really important to the high-risk occupations, and really the health education piece of it, educating these people that work in these high-risk occupations is very important too, because they may just not be aware. So any occupation where people are coming into direct contact with birds, bats, soil, or dirt, any of those folks would really be the best target population for administering not just the PPE, encouraging proper hygienic practices and hand washing if they did come into contact with any type of excrement from birds or bats, but also really being able to educate them about the signs and symptoms of histoplasmosis and encouraging, regular diagnostic testing such as chest scans to ensure that they, have not developed histoplasmosis, and if they have, they would be able to detect it early. Another recommendation to address histoplasmosis would be to improve surveillance efforts. By improving surveillance, we would be able to improve detection of histoplasmosis. And then, continued surveillance in the 13 states that are reporting, expansion of the reporting to other states, and collection of additional data elements would allow for public health professionals to better understand the year-by-year trends in changing epidemiology of histoplasmosis, because we want to be able to identify the populations at risk more effectively and be able to guide public health interventions that may be developed from this improved surveillance. So transitioning histoplasmosis to the nationally notifiable status would be incredibly helpful for more comprehensive reporting, and truly needs to happen. So that would mean that all the states in the United States would have histoplasmosis as a reportable condition, as opposed to just the 13 states as it is currently. Suggestions for further research on histoplasmosis. So I wanted to speak a little bit about the implementation of an intervention program. So in areas where histoplasmosis is most prevalent, an intervention program including chest screenings and better control measures could be conducted. So for instance, there was a study that was conducted on the implementation of a lung cancer screening in patients that lived in areas endemic to histoplasmosis. So this study concluded that lung cancer screening in a structured program successfully identified patients in early stage lung cancer with limited unnecessary surgical interventions. So that could also be applied to histo. So I think that an implementation with that strategy could be something that needs further research. The effects on climate change, which would include the geographic spread of how climate change is affecting this fungi to grow and proliferate. The effects of climate change, exposure prevention, improving clinician and public awareness could help reduce illness and save lives. Understanding the geographic distribution of histoplasmosis would be helpful in targeting those prevention and control measures. So a big piece that I did want to speak a little bit more about is improving clinician and public awareness. So that would include antifungal treatment outcomes, reporting of that, and then clinical diagnostic algorithms. So there is a lot of opportunity for clinicians to be educated about histoplasmosis and other fungal infections and how early detection can be improved. Implementation of the evidence-based prevention or intervention program. So due to climate change, as I've mentioned, environments where this disease-causing fungi might live are expanding. So histoplasmosis cannot spread from animals to people, but we know that it can infect both animals and humans who are exposed to the fungi in the environment. So an initiative called One Health, it's essential for the control and prevention of fungi that can spread through the environment between animals and people. And it examines the interconnection between people, animals, plants, and the shared environment. So, and that also includes antifungal resistance, which we are also beginning to see. And then the CDC has begun Fungal Disease Awareness Week, so think fungus. If you don't walk away from anything with this presentation, I want you to think fungus. So obviously the efforts there are just to help to raise awareness in the public, although it's not necessarily an intervention program, but it really is essential because so many of these fungal diseases often go undiagnosed. So being able to increase that awareness is one of the important ways that we can improve early recognition and reduce delays in diagnosis and treatment. Please take a moment to review my references for this presentation on this slide and the next. Thank you so much for your time today. I hope you enjoyed this presentation, and please feel free to ask any questions. Thank you so much.